Hi, I'm Dr. Scott Worden, the TOS guy from beautiful downtown Sunnyvale, California, where we're getting some nice fall foliage here. It's a beautiful thing in California. I hope you're all doing well. I hope everybody's looking forward to Thanksgiving with their family and their friends. And I'd like to remind you to please hit the subscribe button and the little bell next to it. Everybody who likes our videos helps us grow on YouTube and helps raise our awareness so that we can meet other patients who may not know about TOS yet. So mash that like button and the subscribe button and the little bell. Today, we're just going to do a little review of some of the things that we are grateful for here with our team at Vanguard Specialty Imaging. So the first thing I'd like to say we're grateful for is that over the past year, we've had a chance to follow some of our patients through successful treatment and reclaiming their lives. We have Jake, a great swimmer in college, who's progressing forward and going to dental school, and he's doing great. And then there's Ariana, who's on the East Coast, and she is going to school to be a medical professional as well. She is one of the most charming, bubbly, live people. So it's really, for both of these young people, it's a great reward for us to see them get diagnosed and get treated and start that pathway to recovery. And we're happy to connect any of you with them if you need your own little boost to pick yourself up. The second thing we're grateful for is that we made connections with a bunch of new TOS specialists around the country. And one group in particular I'd like to mention is the really progressive group at Emory. That's Dr. Eric Wagner, the surgeon, and Dr. Robbie Bowers. They're young, smart, very progressive, and they're building a program there to help patients with upper extremity pain syndromes, including TOS. Now, TOS is a real challenge, as we all know, but they've got a really great systematic approach and an algorithm to diagnosis and treatment. We just did a video on them 2 weeks ago, and if you'd like to see that, it's on our YouTube channel. So please don't forget to check that out. The third thing I'd like to say that we're grateful around the time of Thanksgiving is that we've been expanding our market. We have a new partner, an imaging partner in Atlanta, Georgia, which coincidentally will help us to work with the aforementioned great team of Dr. Wagner and Dr. Bowers. And we do look forward to working with them on patients and hopefully learning a lot from them. But we're also working on another big city, Chicago, and we'll update you shortly on that. And we're happy in the other cities we work in. We are always looking to expand and make our NeoVista MRI more available for people in more places. But don't forget, even if you don't live in a city where we have the NeoVista MRI, you can reach out to us for a personal consultation with me, and we can help connect you with TOS specialists that you might need to see. So the next thing we're grateful for is a very interesting situation that came out of the blue and came to us instead of through us reaching out. A young woman who's a sophomore in high school at a very nice school on the East Coast who suffered from TOS when she was younger decided that part of her job, part of her life in overcoming TOS was to learn enough about it to make a difference for other people. So this young woman contacted us. She's smart, she's motivated, and she has helped us start a research project, which we're going to be releasing shortly. That we hope will really help establish some baselines for the thoracic outlet in normal people and patients with thoracic outlet syndrome. She's done a great job so far, and hopefully we'll have her on here to explain it for herself in the not too distant future. So we're thankful that we get contacted by people like that. I'd also like to point out that because of people like you who view us, our channel grows and we reach more people, which enables someone like this young person to reach out and find us. So when you subscribe to us, or when you add comments, or when you ask questions when any of our live streams, it helps us grow in YouTube. It helps our visibility, which then in turn helps other people with thoracic outlet syndrome, again, who might not even know the name of the disease. So keep up the good work. And then I'd like to say, with our increasing awareness, we've been able to meet new specialists and doctors, as well as new patients who come to us, many of them through these videos. So our final thank you is to you, our viewers, who help us by spreading the word of TOS and by participating in our community. So I hope you all have an equal list of things to be grateful for at Thanksgiving. And if you have any questions, I'm happy to take them. Herb, have we got any questions or comments on that short period of time? All right. Jim says, I fell in my kitchen. Can that result in TOS? So any type of fall can result in TOS. It's usually something that impacts the neck and the muscles that support the neck. And remember, the head and the brain weigh about 8 or 9 pounds, and they're sitting on top of this thin cervical spine, which is really supported by a beautiful set of muscles that work very quickly to help support the neck. But if you fall and hit your head or neck, or conversely, if you fall on an outstretched arm, and you have sudden contraction of these muscles that support the head and neck, those injured muscles in the right people who have the right anatomy can then suffer from compression or tension on those nerves of the brachial plexus, which results in TOS. So, yes, it's common that a trauma can cause TOS, which includes falls. It includes sporting events. We've had patients from volleyball players to baseball players to rock climbers, basketball players, swimmers, quite a bit. So athletes can get it. Motor vehicle accident victims or motorcycle accident victims can get it, whether they are hit from the back or from the side. And then remember that there's another group of TOS patients who come from chronic overuse, like working in an office with non ergonomic workstations, or people who perhaps work as manual laborers with their arms over their heads a lot, UPS workers, painters, that sort of thing. So thanks for the question, Jim. Ah, that's so nice. I love this channel. The videos are so helpful. Thank you. Thank you. I only have TOS on the right side, but I feel like it's also on my left side. Is that normal? And that's Smoothie from San Diego. So, it's a really good question because we do get people who have it on both sides, and we do get people who have it on one side. And we get people who get treated for that one sided disease who, after surgery, notice that their other side has very similar symptoms. Now, that may be due to the fact that they just didn't notice the symptoms on the other side because the first affected side was so severe. And we all know from the TOS, excuse me, we all know from the TOS patients we've dealt with how hard it can be, how much pain there is, and how much psychological involvement there is trying to get help and support to get this resolved. Sometimes just the work for a patient to get a diagnosis is a struggle. So there's a lot of reasons why we focus on the side that's abnormal. And perhaps during that time, the other side has lesser symptoms and the patient doesn't know it. But also, it's possible that once your first side is fixed, you start having a more healthy lifestyle. You start doing the things that you wouldn't do before. And now that stresses your body just a little bit. And that brings out the other side, which was, let's say, subclinical. It didn't have quite enough compression and tension to cause symptoms. But now that you're freer and better with your good arm, now that bad arm that was minor before becomes evident. So, yeah, this is not an uncommon situation to have TOS on one side and then develop it on the other side. Number one, if you haven't had surgery, go see a TOS specialist. He or she, if they do the right provocative tests, will hopefully be able to bring out even minor symptoms on the other side. So you'll have an idea that it's on both sides. In general, it doesn't change treatment. If you're seeing a physical therapist, they might work on the other side as well. But if you're going to surgery, they would still go to the dominant side first. If you're right-handed and your symptoms are on the right side, that's a slam dunk. If you need surgery, they're going to take care of the right side first. But otherwise, if you're going to have, let's say, selective muscle injections, then it might be something that could affect your diagnosis and your treatment. So thanks for the good question, Smoothie. Appreciate it. Johnny Two Bit from Mississippi, Tupelo, isn't that where Elvis Presley is from? My symptoms got much worse when I'm on the computer at work. Does that make sense? I have not been diagnosed with TOS, but I'm pretty sure that I have it. So, number one, thanks for the question. That is a good question. Overuse with computers is a very common cause of this. Now, I don't know if you're using a tablet or something that's in a non-ergonomic position. You know how people hold tablets and phones, or if you're working on a laptop, because laptops, and you can go back and see one of our talks I did about a year and a half ago on ergonomics. Laptops automatically cannot be ergonomic because your face and your eyes are supposed to be where mine are, level, or maybe 15 degrees below level. But then your hands are supposed to be at waist level and below. And there's no way to get a laptop screen and keyboard that far apart to develop or maintain an ergonomic position. So, by definition, if you use a laptop at work, you're at risk and you're predisposed to getting TOS. And they were talking to somebody who's using a laptop right now. I do most of my work on a laptop. But when I work long shifts reading radiology, my computer monitors are higher. They're at eye level, and my hands are relatively low. So I do my best to avoid it. And I've had symptoms occasionally as well. Now, if your work situation involves, let's say, a keyboard, Johnny, on a desktop and a monitor that's not that high off the desktop, you probably are not in an ergonomic position. So that's one thing to address. Some people will get a keyboard tray that's adjustable. It goes and mounts on the bottom of their desk, and then they can lower it to the right point, somewhat above their thighs, and their hands can be more relaxed, their elbows less bent. There are also available ergonomic keyboards where they split the keyboard into two pieces. So instead of typing like this, I don't know if you can see it, you would be typing more relaxed like this. And you'd also want to tilt the hands like this, if you can see what I'm doing. So you don't want them flat, what's called pronated. You want your hands to be rotated outwards. So put your palms flat on the table in front of you and then start bringing your thumb up towards the ceiling. That's the opposite of pronation, and that's what you want to be doing. And finally, there are mice, computer mice that are made that are more vertical like that and more oriented away from the totally turned palms against the table type of posture. So you can reach out to me through our website, Johnny, if you want further questions on where to find good ergonomics. Occupational therapists also can often help with this, and hopefully your workplace has something like that or has accessibility to an occupational therapist. Thanks for the question. All right. Well, that was our last question for today. Again, happy Thanksgiving to everybody. Thank you for attending. Please hit the like and subscribe to us. The like button helps us get more ratings for this video, and it helps us in our general approach that will show up on more algorithms on YouTube. And of course, if you subscribe and hit the bell button, you'll be alerted when our next talk comes up. So thank you, everybody. Have great holidays. I'm Dr. Scott Worden, the TOS guy, and we'll see you soon.